My career at George Washington University really started from a background of how the program was designed. Number one, our founder and first chairman of the department, Frederick Gibbs, his successor, Leon Gensick. What they instilled in us was really the continued search for knowledge.
When I joined the program in 1973, we were in the School of Government and Business Administration. And in 1997, when the School of Public Health and Health Services was established, we became a department in that school.
Being a graduate student at George Washington University, for anyone coming to a place like DC, it's a wonderful place to start. And particularly what was, I think, very special was the level of diversity that I found coming in as a graduate student.
I'm struck by how different the class looks than it did even when I was here 10 years ago or so. There's at least 50% women, if not more than that now. People come from every state, every country. It looks like the real world. And I think that's important.
This field is constantly evolving and changing, and using creative solutions, I think, is one of the things that really sets this department apart.
We're leading the field, and our program strives to develop health services executives who are going to be leaders in the sense of everything they do. We expect them to do good things and to be more than just a manager. We expect leadership from them.
I'm so amazed when I meet students now. When students from this program go out to interview for jobs or for residencies, there is a noticeable difference between the GW students and students from other programs in terms of their preparation and professionalism.
I had residents from other programs, but I always felt that the George Washington students really stood above the others.
Our students are in this kind of large family, if you will, and they're connected to one another in a number of ways, not only because they were perhaps in class together, but through our alumni association. And so they have this kind of network already established when they leave us.
The first time you often experience this and the power of it is when you go on your residency, and many of our residencies are experienced with former George Washington graduates, and I was fortunate to have Sister Regina Clifton and John Brozovich, who were both graduates.
My most meaningful relationship with alumni is with Mr. Jeffrey Flax, as he created the inaugural administrative residency at Hartford Hospital. Through the experience that he created for not only myself, my colleague, and others to come, I was able to develop my leadership and management skills.
Healthcare is going to be one of the leading industries over the next 50 years, and so it's going to be very important that we train the right type of executives to run these very, very complex organizations. And George Washington University and the School of Public Health and Health Services and the department will be right there at the forefront.
What excites me about the future of the program is the new building that will house our department, continued growth.
No matter when you come into an organization, a department, or a school, at the end of the day, those of us who try to leave it better than we found it really is a higher calling. So I really have enjoyed the opportunity to work with other alumni to really leave this better than we found it, and in particular make sure that we've got the next generation of leaders prepared to lead.
I see the program as having a very bright future. There's so much that we've done, but more that we can do, and we recognize that, and we are going to strive to do it.